Now let's get started with our program. The theme of this year's seminar is empowering families to prepare for the future. Courageous conversations. Today's event will include courageous conversations about medical care planning, including when legal services are needed, financial planning, including tips for managing another's finances and preparing for the cost of care, and preparing for and managing grief, including a discussion of hospice and palliative care. We will also have an interactive physical activity demonstration at the end. Before we begin, I want to take a moment to highlight the importance of having these courageous conversations. Having early conversations on the topics we'll hear about today are critical for allowing individuals and families more time to plan for the future. These courageous conversations are beneficial not only for the individual person, but also their support network. This is because planning ahead and having these courageous conversations allow an individual to express their wishes for their legal, financial, and end-of-life decisions. The individual and their family can also review and update legal documents, discuss finances and property, and identify their care preference. To our in-person attendees, we're so pleased to offer health screenings and resource tables during and after today's program. We have 3 health screenings today. The first is the blood pressure screening provided by Johns Hopkins School of Nursing Center for Community Programs, Innovation, and Scholarship, also known as COMPASS. The second is a screening of memory and thinking abilities provided by Coppin State University School of Nursing. And the third is a blood glucose screening and a body mass index screening provided by Zen Wellness. These screenings can be found in the back of the room, as well as in the hallway, just outside the doors. As you can see, there are also many resource tables located on the other side of this room, the names which are shown on the screen. Please take advantage of these resource tables throughout the event and after. We encourage you to take advantage of these health screenings and quietly visit the resource tables. These will also be available during our event, as well as from 11 a.m. to 12 noon. I'd like to briefly review some Zoom features. First, we want to let you know that your microphones and cameras will remain off throughout the duration of the event. If you would like to ask a question, please click on the Q&A button on the bottom of your screen. You can ask a question at any time by typing your question into the box. Where possible, our event moderator will read the questions and direct them to the speaker on your behalf. Second, throughout the event, we will use the chat box to send messages to our virtual attendees for sharing links to helpful resources. Third, Today's event will be recorded. After the event, the recording will be posted to the McCAB website at www.baltimoreMcCAB.org. I'll repeat that, www.baltimoreMcCAB.org. We will distribute this link by email to all attendees, in person and virtual, once the recording is available. Lastly, we will be inviting all virtual and in-person attendees to complete a post-event survey. This will help us gauge the success of our event and how we can improve in the future. To show our gratitude, the first 100 virtual attendees who complete the online survey will receive a small gift by mail. The link to the survey will be put in the chat box at the end of today's event. Rest assured, the link will also be sent by email after the event. The survey only takes a few minutes to complete, and we thank you in advance for the feedback. For those of you who are joining in person, we'll give you a few minutes at the end of the event to complete your survey. We'll provide more instructions later, but you will also receive a small gift today upon completion as a token of our thank you. We also want to mention that we will be taking photos during this event. If you do not want your photo taken during this event, please let one of our event volunteers know. With our housekeeping complete, I would like to take a moment to give a big thank you to our event organizers and co-sponsors. Should be showing on the screen momentarily. The Memory and Aging Community Advisory Board, the Johns Hopkins Alzheimer's Disease Research Center, the Greater Maryland Chapter of the Alzheimer's Association, the Baltimore County Department of Aging, Morgan Cares, the Baltimore City Health Department, the Precision Aging Network, Trusted Hearts Home Care Solutions, Epworth United Methodist Chapel, and our wonderful host today, New Psalmist Baptist Church. Of note, most of these event sponsors also have resource tables here today, so please do visit each table at your convenience. We'd also like to thank several local businesses, including Specialty Marketing and Printing and Strategy Factory. We appreciate their support of today's event. Now that you've met our event sponsors, we would like to get to know you, our audience. For those joining us via Zoom, we have 4 poll questions that will appear on the screen at the same time. These same poll questions can be found on the purple half sheet of paper on the left-hand pocket of your folder. Take a moment and find that, please. Please take out this sheet and complete the poll questions now. These questions will ask, how many times have you attended the holistic health seminar in the past? Your age and your race and ethnicity. We'll give you about 60 seconds to reply to these poll questions by selecting the response that best applies to you. Please complete them now. Our apologies to those joining by phone. You will not be able to complete the poll question. Thank you for responding. For those attending in person, someone will come around to collect your completed poll questions now. You can hold it up so they can see it. Now let's turn to the first speaker. Now let's turn to our first speaker on our agenda. It is my honor to introduce Ms. Sandy Ballard. Ms. Ballard is a staff attorney with Disability Rights Maryland on the Developmental Disabilities Healthcare and Victims of Crime Act team. Her work primarily focuses on providing education and advocacy to clients, their families, and their support systems regarding supported decision-making and other less restrictive alternatives to guardianship. Prior to joining Disability Rights Maryland, Sandy worked as a legal fellow in the advocacy team at the Epilepsy Foundation of Maryland, where she helped advise individuals with epilepsy on advocating for their rights during COVID-19 pandemic. She also interned in the Office of Compliance and Ethics at St. Louis University, helping to educate healthcare professionals on development of new laws impacting their practice. Sandy is originally from the Chicago suburbs and loves to write in her spare time. Ms. Ballard, the floor is yours.
Well, good morning, everyone. Again, my name is Sandy Ballin, and I am a staff attorney at Disability Rights Maryland on the DD Healthcare Victims of Crime Act team. Just as a brief overview, DRM is Maryland's federally designated protection and advocacy organization for individuals with disabilities. We have various teams in our organization. I just work for the DD Healthcare VOCA team, and today I'm here to discuss a little bit about advanced healthcare planning for medical decisions. So just as a brief overview of where we're going to be going, first we're going to just talk a little bit about this background on decision making, about capacity, competency. Then we're going to discuss about less restrictive alternatives to guardianship. And then finally, we're going to talk about one of those less restrictives in more detail, known as supported decision making. So just a little bit of background. So history has shown that people with disabilities and older adults have been discriminated against, obviously at a systemic level. So like in the 1800s, there were the ugly laws that forbade people with disabilities and people with deformities from appearing in public. There was, in the 1920s, there was Buck v. Bell, which allowed for the forced sterilization of individuals with disabilities, which, by the way, to this day has still not been overturned. And so strides have been made, obviously, at the systemic level to ensure that people with disabilities and older adults have gained rights. You know, there's the Americans with Disabilities Act, there's the inception of Medicare and Medicaid, there's the home and community-based services. But even though those strides have been made, there has still been obviously a lot of discrimination that exists. We've seen in our work that people who are disabled and older adults have been segregated in institutions. They've been isolated. They've been forced to retire early. They fail to receive equal access in healthcare. And more importantly, they've been placed at a higher risk of being placed under guardianship orders. And that's based off of the belief that people with disabilities and older adults are unable to make their own decisions. So in discussing about the ability to make medical decisions, it's really important to understand the discrimination that can exist in capacity determinations. So everyone has some level of decision-making capacity, right? We all are able to make some decisions. But how we describe decision-making capacity is that it's not a one-size-fits-all approach. We don't have the capacity to make the same capacity to make all decisions. So it varies depending on the person's unique needs and the nature of the decision. So, for example, on one end of the spectrum, you've got those decisions that you can make, but you need less support to make. So, for example, for me, I am not a morning person, so I make better decisions in the afternoon. So if you were to ask me to what I wanted to eat that day, I would be able to make that decision quite easily. But then you've got those decisions that are on the opposite end of the spectrum, the ones that need a little bit more support. So again, I'm not a morning person. So if you were to ask me to make a big financial decision bright and early on a Monday morning, just as I'm coming into the office, I'm probably going to need a little bit more support in order to be able to make that decision. And in regards to individuals with disabilities, while someone with a TBI may not be able to understand the complexities of a procedure and be able to consent to it quite easily, they're still able to make those day-to-day decisions, like about what they want to wear or what they want to eat that day. And there's an overly broad assumption that older adults and individuals with disabilities lack the capacity to make any decision. And the questions that always arise is the person oriented to time, place, or person? Can they explain the reasoning behind the decision that they made? But the other big thing that comes up is that, okay, that person made a bad or a wrong decision, so therefore they can't make any decisions. And of course, that's incorrect. And so the presumption when it comes to decision-making capacity is that the person has capacity to begin with. And it's going to be the burden on the person proving that they don't have capacity to prove that that person doesn't have capacity. Yes, that's a very cyclical way of describing it. But for example, the assumption in an advance directive or a medical power of attorney is that the advance directive will be valid if it's signed by an adult. Now, if there's someone who is saying that the advance directive is invalid, they will have to prove that the individual who signed the agreement or the principal lacks capacity to even make the agreement valid in itself. So in discussing about the discrimination that older adults and individuals with disabilities face when it comes to this capacity discrimination, that's one of the key elements to remember is that decision-making capacity is not a one-size-fits-all approach. In addition, to decision-making capacity, there's also something called legal capacity, or also known as competency. It's something that we've heard when we watch the legal dramas, that person's incompetent to stand trial. And so competency is a legal principle, and it determines what decisions a person can make and be liable for making under law. So whereas decision-making capacity is about what I want to eat that day, legal capacity or competency is about making a contract or consenting to a procedure. And so every adult, just like in decision-making capacity, every adult is presumed to be legally competent until they're proven not to. And generally, when the burden is going to be, again, on the person who wants to prove that the decision maker is not legally competent. And if adult is presumed to be legally competent, it means that every decision that they make will be recognized under the law. There is a caveat to the burden that if it's like, for example, a defense to a criminal charge, the burden is going to be on the person, on the defense, to prove that that person is legally incompetent to even get the criminal charge or even to be guilty of the criminal charge. And so the ability to make decisions, whether it's a day-to-day decision or legal decisions, it really comes down to that idea of self-determination and everyone's free will to make their free choices. Studies have shown that people who exercise greater self-determination and who have greater free will have improved life outcomes. They can live independently. They can work in the community at higher paying jobs, and they can make greater advances in employment. They're more likely to identify situations where they could be abused and less likely to suffer abuse. They also have greater financial independence and greater money management skills. And finally, they also have just greater community integration. So me being in the legal field and constantly being an advocate for individuals with disabilities and older adults, we're always trying to see how to increase that self-determination so that people don't have to go through guardianship and lose those legal rights that they will if they are placed under guardianship. And that's why we're always advocating for less restrictive alternatives to guardianship. And so in order to understand what those less restrictive alternatives are, we obviously have to discuss a little bit about guardianship. So every state has their own guardianship statutes and their own guardianship laws. In Maryland, guardianship is a formal legal process before the appropriate circuit court. So it starts with the filing of a petition. And with that petition, it requires a capacity determination by two medical professionals who examine the individual who's going to be placed under guardianship. So the judge may appoint a guardian of the persons, guardian of the property, or both. So for guardian of the person, if a guardian of the person is appointed, the guardian will be making personal decisions for the healthcare, the food, the clothing, the shelter. If a guardian of the property is appointed, it means that the individual will act in the best interest of the person's income, their assets. So this could be like filing taxes or making sure that their financial needs are being met. So when guardianship is imposed, there are going to be limits. A guardianship order cannot be used as a basis for commitment to a mental institution. It can also be used as evidence of incompetency to stand trial. So just because an order is over an individual, you can't claim that that person is incompetent. And finally, unless the court orders, a guardianship order does not automatically abridge the civil rights or modify the civil rights of a disabled individual. So even though guardianship does have its safeguards that the guardians are being monitored even after guardianship is being imposed, guardianship is actually quite harmful. If a person is placed under guardianship, they lose the legal authority to make many decisions for themselves. And that can be the ability to vote, the ability to marry, or even the ability to direct their own healthcare or manage their own finances. And even though a person under guardianship has the ability to terminate that guardianship, it's very difficult to do so. And we can actually see that in a real life example with Britney Spears in the Free Britney movement. So Britney Spears, she was under a conservatorship by her father, and she recently had difficulty with terminating that guardianship or that conservatorship. And the reasons that she had difficulty are actually not unique. A lot of individuals, and we've seen this in our line of work, a lot of individuals have difficulty obtaining legal counsel because lawyers are hesitant to work with an individual who has a guardian because the guardian might have more reach and prevent them from talking to their client. There is also an inability to access the medical records because, again, the guardian has control of the medical records and they will be unable to prove that the person has the capacity to then make the decisions. And finally, and most importantly, there's also the bias or stereotypes about the disabled person's capacity. It was found in Maryland that attorneys who are representing these alleged disabled people in guardianship proceedings were using their client's diminished capacity as justification for essentially ignoring what their client wanted and substituting for what the attorney believed was best. And so as a result of that harmful practice, obviously the Supreme Court of Maryland issued an ethics rule change that then now attorneys are obligated to maintain that typical attorney-client relationship, meaning that they have to recognize and respect the wishes of their client, even if the attorney disagrees with what the client has to say. And so because of all of the harmful impacts that exist with guardianship, it's why we are constantly, as advocates for older adults, for individuals with disabilities, are going towards those less restrictive alternatives so that people are still able to retain all of their rights to make their own decisions. So I'm just going to go through some of them briefly so that everyone is aware that these exist. So within Maryland in 2022, the Healthcare Decisions Act was passed, and that was specifically directed towards advanced healthcare planning. And so the Healthcare Decisions Act laid out requirements for 3 separate ones. There was surrogate decision-making, advanced directives, and then MOLST forms, or for life-sustaining treatment. So the first one is about surrogate decision-making, which you can see the statute right here. So it is used obviously for healthcare decisions, but it's used for a single healthcare decision. So let's say that there is not a medical power of attorney, or there isn't an appointed agent under an advanced directive. Then healthcare professionals are going to turn to surrogate decision-making for that surrogate decision maker to be able to make the medical decision for the patient. And so the surrogate decision-making statute has certain priority categories. So they'll first turn to the guardian for the patient if one is appointed. If there's no guardian, then they'll go to the patient's spouse or domestic partner, regardless of even if the spouse or domestic partner is separated. Additionally, they'll then go to the adult child of the patient, a parent of the patient, an adult brother or sister, and finally, they will turn to a friend or other relative. If they turn to a friend or other relative, they will have to fill out additional forms to just prove that they have a relationship and that they know the individual. And so healthcare providers will not turn to an individual in the next priority category until the person in the priority category above them is rendered unavailable. And so another part to surrogate decision-making, or another alternative to surrogate decision-making, is known as an advance directive. Again, it's a part of the Healthcare Decisions Act. And so it's also known as a medical power of attorney. So you might hear more medical power of attorney. That's the same thing as an advance directive, or it's called the 5 medical wishes. So in an advance directive, there are 2 key players. The first one is the principal. And the principal is the person whose wishes are documented in the advance directive. And they're also the one who chooses an agent. And so that's the second key player. The agent is the person who will make the medical decisions for the principal in the event that the principal is unable or unwilling to do so. So the agent has a duty to follow the patient's wishes, and if their wishes are unknown, for example, if they're undocumented in the advance directive, then the agent has the duty to preserve the person's best interests and make the decisions based on what they already know about the principal. It's important to remember that the agent is not asserting the authority to become the agent over the principal. The principal still retain that decision-making capacity, even if an agent has been appointed. And at any time, a principal can withdraw an advance directive. And they can do that simply by destroying the advance directive and informing their medical professionals that that exists. There's also an advance directive specifically for mental health treatment. In addition, there are the MOLST forms, which is for life-sustaining treatment. It basically just consolidates important information into orders that are valid across the continuum of care. They just outline the life-sustaining wishes in the event that the person needs life-sustaining treatment. There is also the Social Security Representative Payee, which is basically a person or an organization that the Social Security Administration appoints to receive the Social Security benefits for anyone who can't manage or direct the management of their own benefits. So it's basically that they have to determine the beneficiary's needs, save any money that's left over, return to the Social Security Administration any payments that were not used for the individual's benefit. And additionally, there is the power of attorney. So in Maryland, when you refer to power of attorney, it's limited to financial decisions. Again, it's the same thing as an advance directive. You've got a principal, you've got an agent, and the power of attorney does not take away the principal's power to act. Additionally, unlike an advance directive, for a financial power of attorney, there is a specific form that Maryland law prescribes. And so another alternative that is in substitution to all of the alternatives I just discussed is known as supported decision-making. And it's a less restrictive alternative to guardianship that allows a person to keep that decision-making ability without appointing someone else to make the decision for them. So like a guardian or a surrogate decision maker. So basically you use trusted friends, family members, and professionals to help you understand the choices. And so we use SDM in our everyday lives. We turn to our community supports, we turn to our family, we turn to our friends to help us make those big decisions. But at the end of the day, we are the ones who help make that, who make those decisions. And so supporters are going to be friends, family, professionals. They're also, they can attend appointments too with the individual, which is something that we saw was difficult during the pandemic, that hospitals weren't allowing supporters into the hospital because of the worries about spreading COVID-19 pandemic. But the Maryland Department of Health has told hospitals that they have to allow these supporters into the room. So it's important to keep that in mind even now, that supporters are allowed into the appointments with the individuals. In Maryland, SDM is actually recognized by law as a tool to prevent, limit, or end the use of guardianship. And so under the law, supporters do not have access to an adult's personal information without their consent. And additionally, a supported decision-making agreement can be used in addition to those other less restrictive alternatives. So if an individual has a surrogate decision maker, if they have an advance directive, even if they have a guardianship order, SDM can also be used. So you can create formal written SDM agreements, or you can create informal ones, which would be like verbally. If a formal agreement is made, it cannot be required for participation in a program, activity, or service. Even though the individual can also choose who the supporter is, they cannot appoint a minor, a person against whom they have a protective order against, or a person who has been convicted of financial exploitation, which makes sense for all three of them because there can be some conflicts that arise if that is the case. So as a supporter, there's certain tools that might be used. Tools are up to the individual who creates the agreement. So the adult determines how the supporter is going to help. So maybe there's going to be plain language materials. Like I said, they might go to the doctor's appointment to explain things in plain language. They might take notes at the appointment so the individual can remember what was said at the appointment and ultimately make the decision after the appointment. They might advocate for more time in making the decision. So the supporter there is really there as a support system. But at the end of the day, the individual who made the agreement is the one who makes the decision. So why is SDM important? It's important because older adults and people with disabilities are subject to those unnecessary and overbroad guardianships. And it's based on that belief that just because they need supports, they can't make their own decisions. And of course, that's not the case. Just because an individual needs supports does not mean that they cannot make their own decisions. But using SDM respects people's voices and their choices, regardless of how they communicate, their age, or the diagnosis. And it also helps a person develop and maintain that self-determination that we talked about, and their decision-making skills over time. Because even if you're using it with the guardianship order or with any of their other decision-making tools, you're encouraging that individual to continuously develop their decision-making skills over time in a way that the individual might even be able to go back to court and say, hey, I can now make my own decisions because I've had practice making my own decisions. And additionally, SDM also prevents the overuse of the tools for surrogate or substitute decision-making, like advance directives, like surrogate decision-making. Even though in those tools, you have someone who makes the decision for them, what we found in our line of work is that sometimes those people overstep and they ignore what the person wants, and they ignore the wills and the preferences because they believe that they have legal authority to act in every single way that they can. But SDM kind of corrects that issue, and it promotes the idea that the individual who may lack capacity has the ability to make some decisions, and that they can be included in the decision-making process so that ultimately they'll one day be able to make their own decisions. So I know I went through that incredibly quickly, but we have time for questions?
We're gonna have a Q&A.
Okay, all right. Well, thank you all so much. So if you have any questions just for the Q&A, I'll wait for the Q&A. Thank you.
Thank you, Ms. Bowman, for this very, very informative presentation. These are definitely topics and courageous conversations that can seem overwhelming at the beginning. Our next speaker is Mr. Dwayne Matthews, who is the founder and owner of DKM Solutions. Mr. Matthews is also a proud representative of the Alzheimer's Association, Greater Maryland chapter. DKM Solutions proudly provides free financial hardships. Mr. Matthews was born and raised in Baltimore, Maryland, and educated at Maryland's biggest HBCU, Morgan State University, my alma mater. His goal is to bring financial education and awareness to the masses, especially to underserved demographic groups. Mr. Dwayne Matthews, we're excited to hear from you.
We go, go Bears, let's go. Good morning, everybody.
Audio, you have to like manually click it. If you want. Yeah, okay, so.
Thank you. Good morning, everybody. We want to change the frequency a little bit. Okay, we up. Want to do some question and answer. I asked everybody a couple questions. Participate, put your hand up. This is the test. How many people in here like to talk about? Like it. Couple hands, right? Okay. How many people in here are uncomfortable about the subject of talking about your money? Hands up high. How many people in here like to talk about other? Oh, y'all pocket watch. I like a pocket watch. So this is a quick overview on what it means to be a caregiver and dealing with people's money. Because if you're in that situation, you are now a professional without the education, without the pay, but with all the responsibility. Well, following me? So you now going to do exactly what I do. But nobody. They're gonna pay you in love. They're gonna pay you in some frustration. The cold hard cash, that's not when it's time. And furthermore, we're gonna overview and touch on a couple of things to make sure that everything stays above board when it comes to other people's money, right? So we all know the Alzheimer Association. Thanks to Ms. Maryland for asking me to come out and speak. I was gonna say a couple more things about myself. That was a nice overview. I appreciate y'all. Yes, I was born and raised in Baltimore, right over there. Like literally, I don't know where the Sunnyside is, but I grew up in Sunnyside. My grandmother was restricted with Alzheimer's dementia. I had to get rid of her home. Realtor was right on that end. I walked these streets. I ran around them. I've been from this area. So it is a trip to be back around here now, all these years later, talking about this particular topic in this way, right? Stay close to the computer and sit online. Okay, cool. I won't move around because I have ADD. So listen, we're going to talk about how caregiving affects your finances, right? We're going to talk about a list of financial documents, some basics that you should have ready and available if you're taking care of another person's money, right? We're going to talk about some useful discussions about financial decisions, identifying steps to lower chances of financial abuse, and we're going to talk about a backup, right? Taylor, one of my top agents, say hi, Taylor, and office director, she is handing out the official paperwork from the Alzheimer's Association. Always remember alz.gov.org, check the websites. Those phone numbers on that pamphlet, that packet of papers, are vital information. Hold on to the packet, take it with you, don't lose it because you can refer back to it. I'm gonna hit a couple of those topics, and we're gonna hit them hard. But also, this is gonna be a very frank conversation. Who likes frank conversation? Like real direct talk. Cool, I love that. So listen, money and things that are worthy of money are what's considered finances, right? Do we all understand what financial literacy is to a certain extent? Cool, right? Loving seen, touching seen. Now I'm gonna come off this slide and I'm gonna talk to all of y'all plain and clear. Nobody raised their hand in here, but one person in the back and one person over here when you said you like talking about it. So if you don't like having that conversation, you have to change that mindset, especially in our community. Because I grew up with people telling me stuff like, and if you say, if I hit you, I don't mean to hit you. That's none of your business. Don't worry about how much money I'm making. Don't worry about what I got. That's gonna all work itself out. And I don't want to talk about it. Big ones, right? Full ones. I don't want to, and I don't want to talk about it is the strong. Some form of long-term care before they die. One way or another. There was a stat that was thrown out by the presenter before me that either you are a caregiver or you're going to be a caregiver. So we all know that that's true. Why don't we have the things in place that will help us and sustain us if, God forbid, we are in the need to be a caregiver or we are in the need of a caregiver? And better yet, if you are responsible for somebody else's money and you don't know how to handle your money, what situation are you now in? If you broke, I'm just saying, if you broke, and now you gotta stay home to watch your grandmother, or your aunt is sick, or this, and now you gotta miss work, where are we at in that situation? My friends call me D Math. I hate it, but I love it because I only care about math. My last name is Matthews. I play on words because numbers just don't lie. And if the numbers don't add up, if the income that's coming in is not matching what needs to be paid, we are all in trouble, right or wrong? Can I get an amen? Okay, so first thing we're gonna talk about is what you need to do to prepare yourself mentally and emotionally to take care of somebody else's money. And one of the most important pages on that sheet, we talk about having important conversations. How do we have them? I don't care what y'all take out anything else that I'm about to say, anything that's on that paper. If you're not prepared to talk to your loved one frankly about their finances and their situation and their planning and what the plan is, we are already behind the 8 ball. Can we all agree on that? Okay, so some tips on how to have these conversations, right? This is even worse. These are some of the scary statistics of what it's going to cost you out of your pocket to be a caregiver. Now, y'all, I'm going to speak very frankly. I love these slides. These slides are cool. We can go through this whole thing and break down, what it looks like, worst case scenario. But I want to reach y'all mentally, and I want to touch y'all hearts. Because if we don't, as communities and families, change how we decide to plan for these things. These are all about decisions. I am a professional pocket watcher. How many of y'all know what pocket watching is? Pocket watching means I'm going to tell you what you do with your money by observing. Pocket watching means I'm a little nosy when it comes to what people do, what they say they don't have. If y'all see where I'm going with it, what you say you can't afford, because everything that goes in my mind tells me that you're probably wrong because I'm looking at it, right? So these things we're going to talk about, and I'm going to be direct as I can be because I don't have a bunch of time. We're behind schedule. I'm going to knock us right back on schedule. Y'all real quick, y'all ready? If you don't have long-term care, you're in trouble. Write it down, LTCs. If you don't know what insurances you have, if you don't know what they cover, and I'm not saying you got to go and ask your agent or you got to go find it. I don't have to call my mother anymore and ask her for my social security number. I memorized it. Why? Because it matters to me. It affects me, right? You should know. You should know what you do. You should know how it works. And if you don't, and you need that education, ta-da, that's how this became a thing. I was on the other side of this fight, telling people no. Like I know insurance companies like the back of my hand. I'm a senior benefits specialist. What does that mean? That just means I'm in the trenches every day watching people tell y'all real stuff. And because I don't like no personally or for anybody I advocate for, I figure out how to get around the tools. Now you want to talk about the finance side? All I do is show people how to hold on to their money and make it grow. It's not super duper complicated. It's not the biggest thing in the world to do, but you have to be ready to have the conversation. How many people in this room, put your hand up again and don't be embarrassed, have ever sat down with a professional about what you do and don't have? That's not enough people. That should be everybody. Somebody should have sat down with you and reviewed what you have thoroughly and be able to explain it to you to the point where, just like the speaker before said, you should be able to explain it back eloquently and plainly, right? That's true empowerment. That's true evidence. I was invited here to talk about preparing for the future. Preparing for the future starts right now. We're in a place of worship. And somewhere, and I've never worshiped here. This isn't my home, my worship home. But I'm gonna bet my last dollar that somewhere somebody told somebody here that what you do and prepare for today is going to dictate your future. Knowledge without action doesn't mean. So again, I'm going to tell you that this goes down to connecting with your loved ones way before somebody ever walks up and says, this is the diagnosis, because you should be watching them, right? We all know the indicators for Alzheimer's. That's why we're here, right, Miss Marilyn? That's why we're here, because we can go back, see the vendors, get your screenings. But way before that's even a talk, let's change the conversations in our home around money, the future, planning. Because I'm going to tell you the biggest misconception in the world is that you can't afford to make sure you're good if something happens. That's not true. Take it from a professional pocket watcher. You can afford it. Yes, you can. It becomes down to decision making. And do you want to do it? And do you have the education to know what's available? And that is another reason why I'm going to continue to stay. I'll go anywhere Ms. Marilyn asks me to go. I'll go anywhere anybody invites me, because the education is the part of the empowerment. Do you even know this stuff exists? And I'm going to tell y'all, no offense, no, you don't. You don't know because it's not your business to know. That's not your profession. I wouldn't expect it. That's what people like me are for, and that's what God put me on this earth, to explain things to people in a very, very plain way, to bring it to these communities that really nobody is coming to look for us. Only the top 1% of the people in this country have all the information because they have all the money. Let's just be clear. I've dealt with people that had millions of dollars in the bank and it disappeared off of a diagnosis. I've dealt with people that had nothing and then a diagnosis bankrupt. It does not have to be that on either side. I have caregivers right now I'm helping scramble and move around because they are missing 2-3 days of work a week and they can't afford to do that. So how do you pivot? What's the alternative? And it really starts with you being able to sit down, be vulnerable, be honest with yourself about what you do and don't know what you have, what it really means. I'm going to tell y'all one of the biggest heartbreaking things is people telling me, I got that. I know, until something really happens and you didn't really read it, and you don't. Because these companies are looking to tell y'all no for Alzheimer's, right? Do y'all know that? Let's be frank too. Do you know companies are looking to tell you, no, I'm not going to give you any money, no, we're not going to cover that, no, we're not going to do this. Okay, but there's ways around it. And if you don't know how to have those conversations, now you're, like I said, I'm trying to impart and pass on a little bit of information and confidence to caregivers, because now you are me. You and me, you gotta call a company and try to advocate for somebody. You have no problem, no clue how to do it unless you went to school for finance, as I saw you in the morning. Or you lived it, you know what I mean? And now you know. The support for the caregivers are here too. Vent, yell, scream hot. Because it's not an easy thing to do, to be responsible for somebody else's money that they worked their entire life. And people get really, really sensitive about the things they've acquired, as they should. You work hard for it. Nobody wants to see it disappear or have anybody take it away. Do they? Anybody here like to be? Put your hands up if you like being stolen from. Don't feel good. Come from a Baltimore kid, West Baltimore kid. Don't feel good to have somebody rob you. And I'm going to tell y'all something too. If you are in a situation where you feel like something is not above board, and even if it's a family member, y'all see where I'm going with this? You hold them accountable. In that packet as well are several resources where if somebody is running afoul of your finances or anybody's finances that are in a vulnerable state,
I think that is one of the most disgusting things that you could ever do to somebody. I think it's sneak thievery. I've never respected it. And I think that if we hold people accountable, family or not, that will rectify the situation very, very quickly. And you also have to be cognizant and ready to call a spade and watch the numbers. Y'all got budgets? Again, back to what I said at the beginning, it's hard to be a caregiver if you don't know how to handle your own finances. So do you have a budget? Do you know how to budget your own money? What are we really doing? Can you allocate funds? Do you know how to review it every year? That's in the packet too. You should be reviewing somebody else's money with them quite frequently, just out of respect, to give them their dignity, to know where the things are going, and also make sure everybody's above board. Everybody. Personal story. My grandmother got sick. My aunt lived right around the corner. God bless her. She was doing the best she could. Some things happen just because you just don't know any better. It's not because you're not earning as hard or you don't love that loved one. You might have made a mistake. You might have made a mistake. Some tough conversations, some tears, me getting loud and then laughing and getting loud and then laughing and saying, no, look, we're gonna push this, we're gonna push this. I made everybody, because now it's my family that I'm doing this to, right? So everybody here has to get comfortable with being uncomfortable with the conversation about money, planning, and let's just be clear, insurance. We don't use insurance enough because we don't understand what it really does, what it can do. We don't understand the value. We don't understand what it should cost. It's such a wide range of things. That's just not what people do. That's just not what people do. So lean on these organizations. Reach out to the Alzheimer's Association. Be willing to be open and learn and sit, because there are resources. New days are coming, y'all. New days. This technology that's out here right now, this is not the 90s anymore, not even early 2000s. This is new. So seek out the information and be ready to use it. I'm Dwayne, that's me. Listen, that packet is gold. Keep it. My intention, hopefully I executed it, was to stand up here and give y'all some realness, that you really understand that there are resources out here, people like me out here, like Taylor, that really want to help. But the conversation starts in your own home. So if you can't even have that conversation, don't. What help can I give you? You have to get comfortable. You got to be comfortable being uncomfortable, depressing, and talk and figure out what's going on. That's it. That's me. I want to thank everybody for letting me come out, run my mouth.
Thank you, Ray. Excellent presentation. Courageous conversation about finances can be hard to approach. So it's extremely helpful to have all of this information to help guide those conversations. And as Dwayne was talking, I was looking through it. So take advantage of all of the materials that you will be receiving today, in particular this one on finances, because it is a courageous conversation. Our next speakers are Ms. Anna Somolsky and Ms. Zakia Goodwin. Anna's strong background within the Americans, Ukrainian, and Russian cultures provide her with a dynamic perspective, as well as insight on the multi-layered needs to focus on an effective patient plan of care, effective patient plan of care. Her focus is to provide solutions to healthcare organizations by incorporating her knowledge and expertise of palliative medicine, understanding the dynamics of care, planning, and chronic disease management is something that Anna is passionate about, as well as providing this knowledge to medical providers to enhance general care of the patient population. Anna is joined by Zakia Goodwin, who strives to create a safe, accepting, and non-judgmental environment for every individual. She's passionate about working collaboratively through evidence-based practices, assisting individuals to overcome obstacles and move forward and thrive. Anna and Zakia, we look forward to hearing from both of you. Okay, it's yours.
Thank you so much for the warm welcome. All right, so we have the slides. Okay. So how's everybody feeling so far? Good. All right, wonderful. We promise to make it engaging. I don't know if it's going to be as engaging as the last speaker, but we'll get there. I think a lot of the conversations that we heard this morning really segue into what we're going to talk about. So navigating stages of life and what that means. So when we talk about advanced care planning, that incorporates advanced directives, that incorporates all these wonderful things that we talked about throughout this journey. So our goal, our mission today is really going to be to have a journey in place. So within the stages of life, we want to ensure that we have as much of a plan as possible within every chapter of our life. So chronic disease management, there's different episodes that we go through. There's progression that we go through, and we have to have preparedness involved. So this is a really important slide. 88% of Americans feel comfortable discussing issues related to death and dying. That's a really large percentage, but only 42% have a living will. And that kind of segments into, what was previously discussed. A lot of people are really uncomfortable with writing down those thoughts and feelings that we have. But we're going to talk about why it's so important. So when we talk about advanced care planning, of course, there's tools that we utilize, and those tools, we want to make sure you have a successful plan. Advanced directives is a written statement of wishes, preferences, and choices. So some things to be mindful of when we think about advanced care planning, there's 5 steps. Think, what are your values, wishes about your care and your medical procedures. Everybody has a different, disease process, right? They might have a similar disease to somebody else, but their process could be different. So it's really important to know how we would want to cater to our own needs. Step 2 is learning specific medical procedures, what they can and can't do, and as it relates to us specifically, really making sure that we're talking to our specialists, making sure that we're talking to our primary care physicians. Because a lot of times, if we're not having those discussions, we don't know where we go from here. Step 3 is making those choices. So the advanced directives, and into the next slide, being able to make that choice, that medical power of attorney. Why is it so important? Because when we do not have the voice and we can't speak for ourselves, we want to make sure whoever is speaking for us understands what we would have wanted when we could speak for ourselves. And it's important to choose the right person. When we're making that choice, we want to make sure that we're discussing with that person we're electing the specific things we want, writing them down, making sure that it's very well known. And something really important to remember about advanced care planning is choosing a document that articulates all of this specifically. In the advanced directive, and this is something that when you walked in, you probably saw, but this is what it looks like. And we're going to have a copy out as well. And it'll be in the handouts as well. And 5 wishes. So both of these navigate through the process really well. So some key elements to remember as we're doing the medical power of attorney is that you don't need a notary. And we're able to just have 2 witnesses outside of the decision maker. Your decision maker doesn't have to be present during the signage of this particular document, but they have to know that you're electing them. And making sure that a medical power of attorney document, making sure that any document that you have in place for when you can't make decisions any further for yourself and you need that voice to step in, making sure everybody has a copy. Your primary care physician, the person that you've elected, and making sure there's a copy in your home as well. Having that discussion is extremely important. And step 5, of course, is reporting those wishes. We'll go to the next. All right, so making your wishes known. Something else that's really important to remember is that on caringinfo.org, we do have that as well in place. Next slide. All right. So we're going to segue a little bit into the next realm and making sure that everything is in place, but also making sure the financial end is really important as well. So I'm going to segue this into Zakia's option.
Thank you. Good morning, everyone. Good morning. I want you to close your eyes, right? Just for 1 minute. I want you to raise your hand if you actually have an advanced directive, or if you've seen one before, or have one written out. Thank you. Open your eyes. So today I'm going to talk a little bit. I am a hospice social worker. And I know with that word, like, fear anyone? Is there any fear around that? You can just raise your hand or thumbs or pinky or kind of wink an eye. Is that fearful? And so initially before I became a hospice social worker, it was very fearful. I was very fearful of that word and just thought about death and dying. But I want to do some stigma around that with end of life care. Personally, for me, I had a girlfriend. This is why I got into hospice and just spreading the word and wanted to, give some enlightenment. Because I had a very close friend of mine who was 36 years old, and she passed away due to cancer. And so when I walked into her home, there was a hospice social worker there just asking about advanced directives, asking about a mobile form, asking about her financial power of attorney or her medical power of attorney. And at the age of 36, that's not something that was on my mind. Is that when you guys mind at that age? No. So we want to talk a little bit about that because scripture does say that people perish for lack of knowledge, right? Not saying that anyone doesn't have that knowledge, but today we want to be able to impart different knowledge, just to talk about have a courageous conversation that might be tough and difficult to talk about. End of life care, what that might look like. That's not saying we're pushing anyone into the grave, but we want to talk about what that means, right? So when we think about advanced care planning, when we think about future medical decisions, we want to think about putting that on paper legally, right? So that's writing out your advanced directive. That's writing out your wishes. And I talked before about those 5 wishes. What are them? Who are the persons that will make those financial decisions for you? Who are those persons that will make medical decisions for you? Has anyone thought about that yet? Yeah. Mm-hmm. So we want to begin to start writing that stuff down and making it legal, right? So there's different ways that you can do that. You can print offline from the state attorney the advanced directive form, or you can go to your family lawyer. Does anyone have a family lawyer? If you don't, there's legal aid. Has anyone heard of that? Or has anyone heard of an elderly lawyer? Okay. So if you haven't heard of that, I'm going to give you the number. You have a pen for legal aid. If you're in Baltimore City, and I'm a little nervous, but I'm working through that. Good. So Baltimore City legal aid is 410-951-7777. Baltimore County is 410-427-1800. For those that are outside of Baltimore City or Baltimore County, you can call 211 to get additional resources, and that's for anything. Even if you have issues of figuring out how to log on and actually print out the advanced directive, you can call 211 and they're available to help. Also regarding mental health, if there's anyone that has a crisis or experience someone else that does, or know someone that is experiencing elderly abuse, you can dial 988. That's just a little tidbit. So let's talk a little bit about what a durable power of attorney, right? Or what a power of attorney might mean. Does anyone know what that means, a power of attorney? So it's someone that specifically acts on your behalf. If you get a durable or financial power of attorney, that's one that's going to make financial decisions for you.
You want to choose someone can be your advocate. That's what they will become, your advocate. You talk about a medical power of attorney. That's someone that's going to make medical decisions for you on your behalf. So you want to choose someone that's going to make a decision that will honor your wishes, those 5 wishes that we talked about. And those most forms, some people decide D and R, we'll kind of give a handout on that. And some people decide to remain a full code. Are we familiar with those terms and what that might mean? Good. Okay. So we'll give some additional information on that. It's very important when we talk about advanced care planning to start talking with our doctor about like what that means and writing out your wishes, and also talking with family members about who will make those decisions. You can have a primary agent. You can also have 2 secondary agents that will honor your wishes. Also, you want to think about funeral planning. To talk about funeral planning, right? So I'm here to just talk about, keep it real. As a hospice social worker, I walk into lots of situations that can be very chaotic and very frightening for people. And I am there to help navigate and assess psychosocial needs and help to plan. Sometimes within our community, talking about a funeral, we don't do that. I think Dwayne or the other guy mentioned earlier, there are some things that we just don't talk about, right? And that could be because I don't want to anticipate dying anytime soon. But when you have things legally written out, you don't have to worry about that. Has anyone ever planned a baby shower? Yeah. And has anyone, why do you plan a baby shower? We're like anticipating the things that we'll need for the baby, right? And then some of that stuff, I don't know for the moms here or dads, half of it you might not use, right? But you had the baby shower, and so you anticipate I might need this, it's taken care of. If we look at end-of-life care and then planning things like funeral home choice, right? Not planning your arrangements, but deciding which funeral home would I choose? Do I want burial? Do I want cremation? But really just being able to discuss that stuff and just put it away. You've already kind of talked about it. It's not in a box hidden, where if something was to happen to you, no one would know. So I just say all that to say, like, if you can, it's very helpful to start with advanced care planning and thinking about what your medical and financial needs will be.
Thank you so much. And that does segue into, right, that planning portion. So while we're trying to figure those things out, when somebody is dealing with chronic disease management, these are really crucial things that we talk about, especially hospice social workers are able to work through that. So we're going to pivot a little bit to understanding palliative care, understanding hospice, understanding these elements. So when the condition starts to change, we go into the next phase of our journey, which is how to support aging in place. And a lot of people, when they hear things like hospice and palliative care, they don't always consider that to be an aging in place mentality, but it truly is for us. And being able to help people through that process of arrangements, right? That future planning. Identifying your support system while utilizing resources available to you. So a lot of people ask us about differences between palliative care and hospice. So we're going to go into this. This is a really great picture that depicts for us the differences between palliative care and hospice. It's circled with curative medicine and palliative care because they work in tandem. So palliative care focuses on when somebody is working through a chronic disease. Typically, it's a patient that has a prognosis of 12 months or less. It could be a little bit longer, but these are patients that are having continued dialysis or chemotherapy or radiation. They're dealing with a serious illness and they need to start working through what's important to them. The palliative care pillars is advanced care planning. So that's when they start having those conversations, pain and symptom management, and figuring out your support system so that we can help identify what are your goals of care. Because as a disease progresses, we have to figure out what are our goals? What do we want for ourselves? That's why the advanced care planning is so important. And then hospice care. So the biggest differences between hospice care and palliative care, and this really breaks it down. Hospice care is federally funded. It's 100% covered. There's no restriction insurance-wise because they do follow suit of Medicare. And under that coverage, the focus and the plan is to ensure that you're able to age in place, but you're also able to activate different levels of care as your condition continues to change. Why it's so important that we wanted to mention the advanced care planning portion the most is because as things continue to progress, right, our body continues to need more. But a lot of times when we think about the body breaking down and the body starting to go through that slowdown, do we want to keep putting the body through more, right? So hospice really focuses on benefit versus burden. It doesn't mean that we're giving up. We are focusing on creating hope, quality of life, and ensuring that we're not leaving our loved ones behind, right? And we're embracing their life. We're creating time. We're able to buy that time from a quality perspective rather than focusing on the back and forth to doctor's appointments, to hospitals, and all these interventions that aren't changing our life-limiting illness. Hospice means that somebody does have a life-limiting illness of 6 months or less. Does not mean that somebody will pass in 6 months. That is our job to continue to recertify that patient. But what it means is to physicians certify that if that disease was to run its regular course, it would be 6 months or less. We have patients that are on hospice for a year sometimes, for longer. But these are items that we want to focus on because when we're embracing quality of life and we're able to help with services in the home setting, we're able to create an impact, a difference. Because when we stop doing so much to our body of poking, prodding, and testing, we're able to give our body the rest that it's asking for because of that slowdown. So we're able to buy more time inadvertently. So comfort care directed, patient may still receive disease-oriented care in certain circumstances. So sometimes patients that have artificial nutrition, if somebody has artificial nutrition currently and they're able to tolerate it and they're still benefiting from it, they can still have it. And that's where that mindset of not letting go of what works for us and creating a customized plan. The key to hospice is expert medical care, pain and symptom management, emotional and spiritual support, truly tailored to the patient needs and also their wishes, creating that customized plan. Making sure the priority is physical comfort, mental and emotional needs, spiritual needs, and practical tasks. Practical tasks come back to, again, instead of spending our time going to appointments for curative measures that are not part of our disease process anymore, really focusing on the task of being able to wake up in the morning and to enjoy our cup of coffee outside, right? Something very basic, but something extremely important to us. Palliative care is one of those elements that it focuses more on our symptom management during our process of still holding on to certain curative realms that work for us. Some people are still benefiting from dialysis. Some people are still benefiting from chemo or radiation during a serious illness. So it's not letting go of all these interventions. It's while these interventions are benefiting us and we're not in that comfort plan quite yet. So that's just something very important to remember. And ultimately, when is somebody appropriate? When does hospice make sense, right? How do you identify it at home? Anybody can activate hospice. It is a choice. So if you are in a situation where you have a loved one that is starting to show signs of decline, they're starting to have weight loss or multiple hospitalizations for reoccurring infections, different realms of changes that are occurring in their chronic disease process, it's really important to reach out to their primary care physician and ask, are we ready for that next step? And why would we want to be ready for that next step is what you're accessing with hospice. So this is just a depiction of what the hospice team looks like. These are folks that follow you throughout the process, music therapy, attending physicians so that we are your primary medical care. a nurse case manager that makes sure that the medication process is always followed very, very closely. Chaplaincy for spiritual guidance. Being able to support somebody spiritually is extremely important as they're going through that end of life process. Creating legacy projects. These are all things that we do. Social work. And then being able to work through those levels of care. So when sometimes people start on hospice, let's say they are starting while they're in a process of being able to speak for themselves and enjoy their life. They said, you know, I want to be comfortable. I know I have an illness that is life limiting, but I don't want to, you know, go back to the hospital if I get another infection. So remembering hospice is extremely fluid. There's times where people say that and they say, 2 weeks later, you know, I'm not feeling great. I kind of want to see what else is going on with me, and they revoke hospice. So there's a lot of fluidity in that. Respite care is something really important to remember, especially for our caregivers that are supporting our patients with Alzheimer's. Caregiver burnout happens a lot, and 5-day stay at a contracted facility is part of the hospice benefit. It's once a month that can be utilized. And then if we get to a point where aging in place becomes more challenging because now our symptoms are developing more, then there's inpatient hospice. But 90% of patients are able to stay at home and age in place. So that's something extremely important to remember. GIP is just for situations when we have that factor. Some things to remember is that also part of hospice, and we're going to leave that 1 minute for Sakia to talk through the grief support. You get 13 months of bereavement. That's something extremely important to remember, and that all of your support services are in place. Bereavement extremely important, and we're going to hand off to Sakia to talk about that.
So we do offer bereavement support and something that's called anticipatory grief as well. So that's grieving the loss before a death occurs, or just grieving the loss of like a job or a position that you had. If you are a wife or a husband and now you're becoming the primary role, you have a caregiver. So we have supports in place to come alongside with your family that's supportive. So our bereavement support services will follow for 13 months after the patient's death or the person's death. And then that comes with phone calls or in-person visits and bereavement support groups. We also have groups that you can do while you're in care with hospice, or other family members can participate in those groups virtually or in person. I actually run a group at St. Agnes Hospital the second Tuesday of every month. Just to talk about bereavement and loss and what that might mean and the stages of grief and loss. So we have a variety of resources. When we're done, we're in the table in the back. If you have any questions, things.
Thank you so much for having us.
Thank you, Anna and Shakia, for that excellent presentation. Grief and loss can be so difficult to manage. So it's important to have resources and tools available. We appreciate your insight on this topic. Since this was the last of today's presentation, we will now start our panel, questions and answers. Known as Q&A. I'm sure we have some questions for our speakers after all these excellent presentations. Panelists, will you please come to the front of the room? If you're joining us in person, please raise your hand to indicate that you have a question. If you're joining us online, please put your questions in the chat, your Q&A in the chat box, and we will do our best to address them.
My question is, how do you want to get all these services for someone, but they're very adamant in not getting the services? Like, in other words, if you want someone to come in, like, you know, for bathing or cleaning the house or something like that, and the person will say, I don't want that, I will continue to do it, and you know they can't do it, then what type of support can you get?
Absolutely. I think that's, hear me now? No. Okay, that's okay. So that's a really great question. No, that's a really great question. So ultimately, you know, if somebody doesn't want to let people into their home, right? And if they're able to access something like hospice, for example, right? Hospice is able to work with you, to work with the patient and their family to make sure that everything is safe, right? Safety is extremely important. So one thing that we talk about in the hospice realm is that when somebody is changing in terms of their mental, their spiritual aspect, different things that are progressing, and let's say they don't want to be surrounded by people as much, part of the expertise of hospice is to be able to work through the changes of end of life. So things like AIDS, they come out 2 to 3 times a week, typically in a home setting. If, let's say, things are becoming more challenging at home, where someone's not letting them into the home, but we notice that it's becoming unsafe, they're having frequent falls, then we talk about the aspect of respite care or getting a placement service in. There aren't caregivers that come out to the home from Medicare, but medical assistance is something that we help folks apply for when we're involved on the earlier upside, so that we can figure out getting activated with waiver. But Medicare doesn't pay for caregivers or custodial care that comes out to the home settings. But hospice is the highest level of a benefit that you can have in terms of providing as much support at home. And it's 24/7 on call. So what happens is, if you're in a situation where you're worried that somebody's unsafe at home, that call is needed. It's like the 911 for hospice. Does that help? Yes.
We're gonna grab a question from online. So someone asked, is the agent for health sometimes referred to as the power of attorney for health force?
Yeah, it is. Yeah.
Okay, nice and simple answer, I love it.
My question is in reference to, I indicated that we can print, an example of a advanced derivative, from the state of Maryland attorney. Do you have, this is a site where they would have, a template or a basis for the SDM agreement?
So in Maryland, there's not like a specific form under the law that has to be used, but just as a self-plug, Disability Rights Maryland does have our own, sample template that we use, and it is on our website. It lays out but like I said in my presentation, SDM agreements can be informal, they can be verbal. If it is a formal agreement, there are, elements of the law prescribes, and DRM sample template agreement hits all those formalized requirements. And the nice thing about it is that it is a Word document, so you can edit it based off of what needs are for the person who wants to create that SDM agreement. Does that answer your question?
So repeat ways you say that I can locate,
Disability Rights Maryland's website.
Another question from online. Are there any free respite services for caregivers?
That's a great question. So free respite rate, that in terms of respite care, that is under the hospice umbrella. So something to remember is that when you have that 100% coverage under hospice, it activates the levels of care. Those levels of care get navigated by that hospice team. So the 5-day stay at a contract facility, that's once a month, that's only under the hospice umbrella of Medicare, where it is technically free or paid for by your insurance.
I have a question, Dwayne. I'm on the other side of the spectrum now. I've been a caregiver. I've been for like the last 30 years. I took care of grandmother, grandfather, and brother. So my question is today, I like to talk about money and I watch my money, but is there a safe time and place? And what do I need to put in place to watch my money so that when I am gone, it's just not squandered away? You have any information on that?
Yes, I do. And I'm gonna give you a 5,000 foot view, and I want everybody to write it down too. And but you cannot walk away from it and take this as individual life advice. We all cool with that? Okay. You should get a trust. A living trust, a real trust. You should put everything that you care about inside of the trust. That protects you from it disappearing when you're gone. That's the best way to transfer wealth, is to have a trust. Did that answer your question? Is that where you're going with it? So you can watch it, keep watching it, but get yourself a trust and you make sure whoever you want to get it when you move away. Everybody here know the word probate? I just told you how to avoid probate. You're welcome. Did that answer your question?
All right, another question from online. I have a Maryland statutory personal financial POA for my husband who has vascular dementia. What is the difference between that and the durable POA? The thing that I have a Maryland statutory personal financial POA. And they're looking for the difference between that and the durable POA.
Yeah, so that's a great question. So it is the same thing. A lot of people actually ask us if you can activate a durable power of attorney as a medical decision maker, and you cannot. But durable power of attorney does act as your financial POA.
Good morning. Thank everyone for all of this great knowledge. I am actually a caregiver and it's actually, I'm the baby out of 9 siblings. So at this point, I'm being like the villain in the family because I try to bring all this good information to my family members. And I don't want to choose not to accept any of my knowledge. And they have all the weeks about guardianships, about power of attorney. They don't understand any of it. So I'm really need help.
Can I speak to that? They know you too well.
Yeah.
They know you too well. The people know you for what they know you for, good and bad. They're never gonna listen to their still little sister about your money. So the first thing you need to do is you need to find somebody you trust and you build a relationship with. And then you bring that education and that information to your brothers and sisters. And you also be prepared to hear this. They might not listen to that person either. That's just what it is. And if you have to be prepared to do what you think is best and what you know is best and what's factual and true. Let's get to our Bible. It's all things done in love, right? All things that are done in factual and true will work out. It says that in the Bible. Then go with it. But no, they never, it is. Like, because it's through the system. And it works the same way as a profession. Like, I can have all of the certification degrees in the world. There's people that are close to me. They will never listen to me. I can show them the money I make. They will never listen to me. It's just, that's just human nature. Don't feel bad. You're doing the right thing.
All right, I have one more question from online. When is it too late to get LTC insurance?
Never. If you got some money. Anybody want to add to that? Never. If you got some money. And I know a lot of ways around it. They might tell you no forward facing because you're too old, you got these medical conditions, or because of these things, that will disqualify you forward facing from LTC. But I'm gonna tell y'all that's a misnomer, because if you got a couple dollars, I could get you some long-term care. There's ways around it.
Mr. Matthews, where you located?
Our office is in Owings Mills, off of Red Run Boulevard, easy enough to find. I'm sorry? Well, I got cards, I'll hand them out, because y'all will write it down. And when we done this panel, I'll give all the cards out that I have go ahead.
Question I like. So I wanna ask. And I have another one. Oh, thank you so much. Did I understand you to say politics here? You can't get any benefit from it, only time.
Yeah, so, no, that's a great question, and we touched on it super brief, so, palliative care is a specialty that's traditionally in, the consultative service is in a hospital, in a nursing home setting. The home setting doesn't have it developed to where it services. But the palliative care consult is specifically to lay out the goals of care during a chronic disease that you have, as well as incorporate symptom management during that plan. But traditionally, they're not coming out to the home where they're providing services like hospice would or home health. So my recommendation would be, if you're looking for services in the home setting while you're still pursuing maybe aggressive or curative treatments, home health is a really good option, so that you can continue to get support and help at home. Physical therapy, speech therapy, those are things that can come out to the home through home health. And then if you're at a point where now we're focusing on comfort and not wanting to go back and forth to the hospital, that's when in the home setting it would be hospice. But palliative care traditionally is activated in the hospital setting that you can ask for, or a nursing home setting. That's kind of the traditional aspect of it.
But I think about 45 years with somebody not going to need more help than what you pay.
Yeah.
I went under the agency, and I go to even more help and benefits than they gave. That's why I was asking, if I can into that again, because I know what to do that.
Yeah, and one thing to remember too, in terms of the aspect of hospice, a lot of people ask us if they can activate a hospice consult at any point in time. You can request a hospice consult from your doctor at any point in time. It doesn't mean that it's going to resolve to a hospice admission, because you still need a 2-physician certification and consent to the service. But there are a lot of people that we see out in the community that want hospice. They might not be actually ready for it. We readdress it every few weeks to see where they are in their process. But that is a good resource to have.
Wayne, before we start next online questions, do you mind just saying your phone numbers so we can get it started online individually as well?
Yes, ma'am. 443-784-5537.
Thank you so much. And about
Text me.
texting,
Text is always great, because I'm inundated with phone calls, text you, and your name, and I will call you back. It's not me, I have other people, agents that are just as capable, I'll pass it on.
wonderful, thank you. And then a question from online. What do you do when an older individual does not remember all their life insurance policies and or banking accounts? How do you help?
You can find somebody like me, and we get to digging into what they don't have, because so everybody's Social Security number is connected to everything you have. And if you have a professional, I can find what they don't have. That's just, hope that's a good enough answer. If you know the company, and maybe you have their social, you can start.
Hi, my name is Cheryl Cornell, and I just wanted to ask a question to the panel. As the caregivers take a journey of taking care of their loved ones, a lot of times individuals do not meet the qualifications of Medicare and Medicaid, and so therefore they can't get respite care. And so how do we find that information, and how do we go about to get those services for those individuals?
So, one of the things that I always tell folks is one of the models of the Medicare hospice benefit is no eligible patient left behind. So something to be mindful of if the question is specifically insurance-based. So let's say they don't have Medicare or Medicaid, whatever insurance they have does have a carve-out because it is a federally funded program. something to be mindful of as well is that if somebody is uninsured, we have that a lot that happens just with folks that are coming from different countries as well, and they might get sick or have a terminal illness that occurs. So these are patients that can have a charity application. So there is no patient left behind. If, let's say, it's somebody that does not have a 6-month or less prognosis or doesn't qualify for hospice, the rest of piece does become challenging because insurance doesn't cover it. It's only under that hospice benefit that it does. But have no fear, insurance always has a carve out. In the 9 years I've been doing hospice, I've never experienced anybody not being able to get hospice because of their insurance plan or because of not having insurance at all. I have that. Yeah.
I got a little close on that.
I was gonna add to that too. If the patient or the person doesn't qualify for hospice, the Department of Aging, the wait list may be a little long. But you can get on there for caregiver resources and additional support.
I know you got it. Go ahead. Oh, go ahead.
I also wanted to add that, when you do, have Medicaid, if you have that benefit already, you don't have to be stuck with the doctor you have, right? That's another thing, that sometimes the information you're getting might be specific to that doctor. You know, call somebody like me, and tell you it's available out there, as far as Medicaid goes in your area. That's another reason why somebody that's really trying to serve the community, you have to know who does what. You gotta get around this community. There is some flexibility. The government's will give you the money, and now it's down to you to learn how to use that benefit. There is some flexibility.
Just to add to, if you have any veterans, there's also benefits there that you may not know about. You may want to get service connected.
Yes.
If you decide to come onto hospice, that's the role of the social worker. That's something that we do help you get service connected with the VA. It usually offers 25 hours of caregiving for the veteran, and additional resources and stipends for their caregiver with their loved one, the significant other that they're actually married to. There's stipends for that as well. And something that I share.
And 417 East State Street is senior service.
Just to say that one out loud on the microphone, 417 East Fayette Street and Senior Service.
Health department, care, commission on the aging, but now they call it care.
So we'll keep that in mind.
Worry about anything, and the man's office is a block and a half.
All right, we have one last question in person before we get to wrap there.
My name is Pence, and my sister has memory loss at this time. It's progressing. I also have 7 siblings, and I just want to know if we're not in agreement with all the aspects. And I was just wanting to know if there was a social worker case manager that could be available or be able to help in these circumstances.
So it would be like the Department of Aging that can help with that, and maybe host like a family meeting. That's something that we do here at Accent Cares, provide a family meeting so that we can gather individuals, kind of help reduce people's anxiety and stress. And they could be experiencing some anticipatory grief as well. But the Department of Aging will be able to assist you with that as well.
Does anyone have the number or just look it up?
Get the number, but they are in the back. The tape.
Okay, thank you.
So something else just to keep in mind as well, because we see this happen a lot, especially, and that's why we really preach about advanced directives, because unfortunately, when we're following the Maryland Surrogacy Law, we have to make sure that all the children of that next of kin are in agreement with that one plan that is going towards it. So one of the things I would also mention is if there's a trusted medical provider, asking that trusted medical provider to walk through what is happening within that medical condition. Because a lot of times, family members are going to, say, I don't want this, or I want my loved one to live longer. But the medical provider can ensure that they're going to give you the realistic options of what is actually in place for that condition. Thank you.
And I also add another one. People are afraid. A lot of those tough conversations are based on fear. And if those are your siblings, you probably can figure out where their fear is coming from. And you have to figure out how to alleviate that fear so the conversation becomes free flowing and the energy is there. Once somebody, because I'm going to tell you my personal experience, your siblings probably don't have a place where they need to have a place. So now they're watching somebody in the worst case scenario to go through something and they're not there to take on themselves. So that's where the psychology of the big one. So you might want to start having that conversation. Okay, guys, what happens if this happens to somebody else? Somebody that really all had. It's my teaching.
Thank you. Thank you for all of those wonderful questions. I have certainly learned so much from today's speakers and from our audience's insightful questions. Let's say thank you again to our excellent speakers by giving them a round of applause. You know, we can do better than that. This is a wonderful. Thank you so much. Now, changing pace a bit, we're excited to get our blood pumping with a physical activity demonstration. We now know physical activity is good for the heart and the brain and can help us manage stress to improve our overall health and wellness. It is therefore my pleasure Thank you. It is my pleasure to introduce Mr. and Mrs. James and Flo Long, representing Moxie Mood, who will be leading us in a physical activity demonstration today. James and Flo Long are owners of Gospel Aerobics and More, which is a personalized fitness program involving cardio, stretching, as well as flexibility training. Every member that enrolls into the programs is treated, trained with his or her individual needs in mind. The staff of Gospel Aerobics and More are certified aerobic, kickboxing, and personal trainers. They're also certified in populations such as seniors and children. A big, big welcome to James and Flo.
Hello, everybody.
Hello, everybody. My name is Florentina Long. This is Mr. James Long. We are Gospel Aerobics and More, and we're gonna have some fun. Exercise can be fun, and if you're gonna participate with us, make sure you spoke to your doctor and you don't have any kind of, joint problems that can keep you. But if you do have some joint problems, do what you can do. Move if you can move. All right, we're ready.
And also the exercise we're gonna do is something that everybody can do. You're never too old to exercise. If you exercise, your clothes will look good on you, sweat is good for you. It'll make you shine like true jewels you really are. So at this time, we're gonna get started with some exercise movements. Okay, what we're gonna do is start out working the big muscles first. Big muscles burn more calories. Right here, let's go and lift. 2,
You can either
3,
stand or sit.
4, 5, 6, 7, 8, and 8. 7, 6, 5, 4, 3, 2, with one side is bad. Pull it one side up. Come on, 3, 2. Now let's pull it together with both. We don't want the other side to get jealous. 3, 2, 1. Now give me a roll. Now roll. 2, 3.
Y'all look good out there.
1, 2, 3, 4. Front. Back. Front. Back. 7. 6. I see you over there. 5. 4. I see you over there. 3. 2. And 1. Now you know when a chicken goes for food, it sticks in that gut. Bring it back. 2, 3, 4, 5, 6, 7, and 8. Now the next one, if you got boys around the house and they take those socks off, they have a little odor to it. Now here you go, right here. You're pulling that back. Woohoo! Come on. Now when you exercise with me, I'm gonna ask you how you feel. When I ask you how you feel, you gotta give me a big woohoo! One more, how you feel? Come on this side of me, how you feel? Over there. All right, ready? 3, 2, now rock. We're gonna loosen those hips up. Even if you're sitting in the chair. Now add arms. Functional exercise movements. Something that everybody can do every day. Now take the hand up. How you feel?
Y'all look good out there.
To the center. Now the next move. Called a walk, walk, walk.
Y'all ready for it?
3, 2, ready? And walk, walk, walk. Y'all got it? Y'all look good. Now y'all ready for it? Go ahead.
All right, I have my own walk, 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 except it's not walk, walk, walk. It's walk, walk, walk. Y'all ready?
Yeah.
How low can you go? Ready? And walk, walk, walk.
So don't tell a lot of it. All right, ready? Tap side to side. Now when they tap, we're gonna reach and stretch it out. Open the lungs up a little bit, ready? Now reach. 2, 3, 4, 5,
Have
6,
fun with it.
7, 8, 7. I see a friend of mine out there. Come on, Reverend, let's get it. 3, 2, 1, to the center. All right, I just left. 3, good, thank you. Now, you dropped that $100 bill, reach down there and get it. Go back to the center. Now right here, we have to put deodorant on every morning. Tap it right here. Put it in that arm.
Don't tell your secret though.
One more. The other side. Put it in the arm. Put it in the arm. One more. Tap it out. How do you feel? Now, keep your heels on. You know, you got those tight shoes on. We had to crease them down to slip in those shoes. Now, ready? Keep those shoes on.
Once again, these are called functional movements.
One more. Right here. Right here, man. We're gonna work with fingers. You like feeding yourself. You don't want nobody to feed you because you enjoy your food, but you can feed yourself. Work those fingers.
Touch each finger to your thumb,
Finger to the thumb.
one at a time. Keep that blood circulating.
One more. Now work that eat the little fat person in the corner all by itself. Now right here, roll that lemon. Make some of that good lemonade. Oh, you're doing a good job over there. He done make 5 gallons of lemonade over there. Y'all give him a big woo-hoo! Squeeze it, lemon. Now, right here, turn it over. Dancing with that money, but it eliminates you, baby. Can y'all get my friend right here in the red? Big. Three, two, one more. Now open the jar. Put half the money in the bank. Put the other half in the jar. Hide it in the backyard. Under the steward shed somewhere. But only one person knows where it's at. Everybody know it won't be the other side. One more. Now, next one. Hip, shoulders, and up. Functional movements. Up. Hip, shoulders, up. Hip, shoulders, up. One more. Hip, shoulders, and up. Next one. Front, up, touch your back. Front, up, touch your back. You got it. Front, up, touch your back. I got it right here. Y'all get him a big. One more. Right here. Ready? Next one. Shoulders, up, up. Shoulders, up, out. That corner, got it. Y'all get that corner. Oh! Now, the next one. Ready? Right here. Down, pick it up, put it on the shelf. Down, up, put it on the shelf.
You know how you put those groceries up?
Up, put it on the shelf. Come
Take it
on.
out the bag.
Give me one
Put 'em
more.
up.
You don't want the other side to get jealous. Down, up, on the shelf. Down, up, on the shelf. Down, up, on the shelf. Wrap it up. Down, up, on the shelf. How do y'all feel? Okay, ready? Now, take that and stretch it out.
Stretch it out.
Down to the other side. Stretch it out. Take some deep breath up. Blow it out your mouth. On the shoulders back. All right. Now give yourself
Give
a hug.
yourself a hug.
As you're hugging yourself, always remember each and every one that you're truly a great gift of art. You came to improve yourself. To be that great gift of art, you truly got to be. Keep doing what you're doing. Keep working at what you're working at. And you will achieve your goal in being a great gift of art you truly got to be.
Always remember, your muscles make you strong. Your mind makes you think. If you listen to James and exercise, they will not shrink.
Spiritual fitness leads up to being a true witness. Next part, you can say it all with me. I'm so glad
I'm so glad
that I am
that I am
the greatest
the greatest
creation
creator
God
God
has put here
here
on earth
on earth
today.
today.
I'm number one.
I'm number one.
I got the job done.
I got the job done.
And I know it.
And I know it.
And I know it.
And I know it.
And
And
I
no.
thank you.
Not for
That was wonderful. Let's give them another round of applause. And I hope your body feels restored. I know mine does. Being physically active can be beneficial to your health in many ways. So we encourage you to find activities that you enjoy. So we encourage you to find those activities that you enjoy. You're safe, and try to incorporate those activities several times each week. It's now time to pivot to our special recognition portion of today's program. I'll wait until you get situated. Thank you. You'll still have time. It is my honor to present this year's recipients of the Holistic Health Seminar Award, including the Outreach Leadership Award and the Trailblazer Award. Outreach Leadership Award. This year's Outreach Leadership Award goes to someone who demonstrates outstanding contributions to empowering the physical, mental, and spiritual health of older adults. Ms. Micah Saunders. Micah empowers older adults to achieve physical, mental, and spiritual health through fitness and brain games. Through her company, Moxie Moon, she also provides caregivers with resources needed for taking care of loved ones with Alzheimer's disease and other dementias. She's a well sought after consultant at senior and assisted living centers in Baltimore due to her high energy approach to promoting self-care. Unfortunately, Ms. Saunders was unable to join us in person because she's attending another community event. However, she has prepared a short video for us today.
Hey y'all, hey! So I just want to say thank you so much for choosing me for the Outreach Leadership Award. I couldn't believe it when the McCab board told me that I was the winner. I was like, what? Are y'all serious? But I'm sorry I couldn't.
What? I don't know why it's not playing. We have to like off. It did that, I think. Share. Yeah, let's show the video. Don't know. I can't hear the notes.
Sorry, bear with us.
I guess that's what's, yeah, I'm gonna go into the slideshow. There's. All right, let's go on. Yeah.
Technology. We all know it, we love it, but it does have its moments. Micah did send in a recording, and if we get it available before the end of the day, we will play it because she's well deserving. We'll go on to the second award we will be presenting today, which is the Trailblazer Award. This year's Trailblazer is recognized for her outstanding contributions in supporting, empowering, her outstanding contributions, and uplifting members of the Turner Station community. It is my pleasure to present this year's Outreach Leadership Award to Arkia Wade. Arkia Wade is a resident and activist in the Turner Station community of Baltimore. Arkia exemplifies the definition of both outreach and leadership with activities that serve both youth and older adults. For older adults, IKEA founded and received grant funding for her nonprofit, the Neighborhood Champions, services to seniors in Baltimore County. I said Camden, it's family, right? Companion, Neighborhood Companions Incorporated, which provides transportation and companion services to seniors in Baltimore County. The organization's mission is to help older adults maintain their independence and enhance their quality of life. On the youth end of the spectrum, IKEA is also involved in Turner Station Scout Troops. IKEA is also a member of Alpha Kappa Alpha sorority, Psi Phi Omega in East Baltimore City, and is involved in conservation and environmental improvement activities in the Turner Station community. IKEA is sensitive to the needs of older adults and pursue these activities with passion, sincerity, and dedication. Without further ado, I'm pleased to present this year's Trailblazer Award to IKEA Wade.
Good morning, everyone. Thank you to the Memory and Aging Community Advisory Board for this distinctive honor and recognition. Anytime I receive an award of recognition for my gifts, I always like to pay homage and respect to my great-great-grandparents, Jerry and Lavinia Luck. Jerry was born in 1849 and Lavinia was born in 1856. They spent the first 16 and 9 years, respectively, of their life in a forced labor camp in Danville, Virginia. When slavery ended in 1865, they were very poor, economically and poorly educated. In 1831, Virginia passed a law that it was against the law to teach slaves to read or write. If you were convicted of doing so, you were sent to jail or had to pay a heavy fine. When they were freed in 1865, their number one goal was to educate their 6 children. One of those children was my great-grandmother, Lottie Luck. The first generation after slavery produced 3 school teachers, 2 physicians, and 1 college attendee at Hampton Institute, now Hampton University. This has created a culture of education and excellence in my family, and as a result, over 100 of these 2 former slaves, direct descendants, have college degrees, including 23 lawyers, 15 physicians, and 5 PhDs. I truly feel like I'm just carrying out the legacy of my ancestors, specifically my grandfather, Dr. William Carlisle Wade, Sr., who spent his entire life servicing the community of Turner Station. I'm continuing my work of excellent service by starting my nonprofit, Neighborhood Companions. I'm just honored to be here, and thank you so much for this honor.
Excellent, excellent. Congratulations again to our 2 award recipients, Micah Saunders and IKEA Wade. As we bring today's event to a close, I would like to turn the floor over to Mrs. Jackie Seth, our McCAB Chair, to lead you with a call to action. So you have some work to do.
Oh, thank you.
Thank you, Ms. Ernestine. I appreciate that. Well, good morning. Good morning still. Right. First of all, are they seeing me really that close to the screen on TV? Is it real extra? Can you guys see me? Okay, great. All right. So my name is Jackie Seth, and I'm the chair of the Memory and Aging Community Advisory Board. And on behalf of them today, as we close the 17th annual Holistic Health Seminar on Memory Loss, I want us to reflect on the knowledge shared today, from insightful discussions on medical planning, financial preparedness, to invaluable tips on managing grief and loss. We've started a journey for empowerment, and I totally saw myself in a lot of these conversations today, especially the one with the siblings who is the youngest. And I appreciate the concept that they see you kind of as the youngest, they kind of see you as that family member. So I do strongly encourage you to still have these courageous conversations and be resilient, because these topics lay the groundwork for that, right? They help you to have a good future. So let's not let the momentum dwindle. Let's pledge right now. Everybody stand to allegiance. I'm kidding, you can stay seated. But to have these conversations within our families and our communities, implementing the strategies discussed today, and initiate these conversations with your healthcare professionals is so critical, and your loved ones, because that will ensure that all, including the individuals facing memory loss, receive the personalized care and support we know that they deserve. But start now. Take proactive steps toward planning for the future, whether it's advanced directives or exploring long-term care insurance options, or safeguarding your assets, which is so critical in our community because you want to pass that wealth on generations to generations through proper legal structures. We've equipped ourselves with the tools to navigate several complex issues that may arise as we age and get older. Remember, our actions today shape our tomorrows, so we really envision ourselves and our loved ones being prepared. Let's take those steps forward to have a holistic well-being and a brighter future for all. I don't necessarily want to stand in the way of all the resource tables that are back there. I want to encourage you to take the extra time if you're in person to get all of the things that they have to offer today. And if you're online, we hope that you can join us next year in person perhaps, but we do appreciate you being online with us today. And thank you to all of the people who worked very, very hard to make this day successful. We do this every year. As someone mentioned, reminded me about it, right? 17 years we've been doing this. I want to spotlight our partners at JHU, Corinne, Cassie, Claire, Sia, and all of our McCAB members, all of the people I see in the back and up here, and our table members and our community partners. We're very grateful. And I want to give a special shout out, since we're naming sororities. My soror, my love, Miss Ernestine, for all of her hosting today. We do appreciate you. Amazing. Yeah. So with that, I will pass it back to Ms. Ernestine. Thank you everyone for attending. See you next year.